Maria is an epidemiologist and a counsellor in transactional analysis with 30 years of professional life in healthcare. She has a classic humanistic background, including the knowledge of ancient Greek and Latin, which opened the path to her studying languages and arts to become an arts coach. She then followed academic studies in clinical pharmacology, specializing in epidemiology at the University of Milan and Pavia. Her past international experiences include time spent in Harvard and in the pharma company in Mainz in Germany. So she's currently Director of Innovation in the Healthcare Area of Fondazione ISTUD, a Center for Education and Social Healthcare Research. She's the President of UNAMES, the European Narrative Medicine Society, and she's on the board of the Italian Society of Narrative Medicine. She's a tenured professor of the narrative medicine at La Spaziana in Roma and is teaching narrative medicine in other universities and institutions at a national and international level. Now, Maria has had the great pleasure and honor, and she would like to mention the people she has worked with, and that's Letizia Ragusa from OASI in Troina, Graziana Grugni from Oxologico in Piancavallo, and Antonio Crino from Bambin Gesù in Roma. So I will now hand over to Maria to present to us, please. Thank you.
Thank you so much. First of all, it's an honor to be here. Thank you so much. I have to thank the Italian association, Andrina Comoretto, because she really wanted to have me showing this and bringing these results to your attention. Let me share the screen. You just tell me whether you see or not. So
yes, that's lovely. Thank you.
Do you see it? Okay, so I will speak about the study praxis. So Prader-Willi, excellence in care in story taking. There is a big difference between a history, so a patient or a person history, medical condition, and the story. In this case, what we collect is a real story. It's the biography. It's not an invented plot, but it's a real plot that we use. I will not go into the details, but first of all, I want to say that all of that I'm going to show are authentic witnesses and stories of patients or people living with Prader-Willi, of their relatives, and of the healthcare providers as well. Well, who we are, I think that you, Georgina, have already been explaining who I am, but I want just spend one word about Fondazione ISTUD is working in narrative medicine since, I would say, since it has been established, so since 2002. So we were really among the first to work with this kind of narrative research. This is the study that I will show to you with an integration, because this study was published on July last year, but you see these are the names: Letizia Ragusa, Antonino Crino, Graziano Grugni, my colleagues of ISTUD, but also so many other collaborating centers. And of course, we have to thank so much all the people with Prader-Willi's association, so la Federazione Italiana Prader-Willi and the Associazione Italiana Lazio delle persone con Prader-Willi. Of course, what we did and what you will see is there is also an update, because the pandemic was a huge turmoil for all the lives of all of us, and disrupted also life of people with Prader-Willi. So you will see a back and forward, yes, moving between a pre-pandemic age and a during pandemic age. So what is narrative medicine? Why do we study it? Because if you just collect numbers, you have a gross dimension of a phenomenon, but you don't have the meaning of what's happening. Let's say, just for an instance, if you say how many yes-vax, they are pro-vaccination, how many are against vaccination, the no-vax, you have just a dimension of the problem, but you don't understand which are the reasons for not being vaccinated, maybe scientific reason, ideological reason. And so you cannot set up proper, let's say, campaign for persuading vaccinations. And I'm saying ethical persuasion, not manipulation. So what we want to stress is that the narrative gives you much more and widen the knowledge of a certain condition. I'll go fast with this. Well, you know much more about what I know about the Prader-Willi syndrome, and I don't want to spend words because I will still time to the giving the word, because it's not me talking, but it's all the people who have their narratives, their healthcare providers, and their family members. What we wanted to do with the Praxis project is that we wanted to collect the narratives for the first time at a national level, global national level, of people living with Prader-Willi, children, youth, and so teenagers, adults, family members, and healthcare professionals. We wanted to understand how to work on the caring and how to work on the curing. We went to identify there was a stigma associated with the Prader-Willi syndrome, and trying to find out some solutions to overcome this stigma. You see that there are two phases of this project. Praxis 1, which was since October 2018 to July 2019, and there was a Praxis during the COVID-19 pandemic, September 2020, so 2 months of collection of narratives, and November 2020. So this was Praxis 1. So we have collected 241 narratives from, and we were just expecting 155. So there was a 70-80% of extra participation. This is a huge results, and this means that we gave voices to the people who did not have, or well, whether they were not organized to leave their own voice. There was no, let's say, such a wide listening operation. Well, so 107 by people with Prader-Willi, children, youth, and adults, 112 by family members, and 22 they were written by doctors and the nurses, so taking care of these people. I will go very fast through this. I will just say that there was a little bit of variation, geographic variation between north, center, and south. It depends on the, let's say, on the activity, also the agency, I would say, of the association. And what I will go now in showing some of the results. First of all, the results of the people living with Prader-Willi. So their narratives are very, very much detailed. I will not go into them. They're very precise, very clear. They are narratives of what we call restitution. It's not me, it's Frank. Arthur Frank, a sociologist, calls them like this. So if I behave properly, so if I follow all the rules, I don't eat food, I will do this, I will take properly my growth hormone, I will be rewarded back with my health again. So these people are people with Prader-Willis. They love to do so many things, and this is amazing. They are artists. They work at home. They were before the pandemic. We will see how the pandemic affected. Also engage in sport, in social hobbies. They love nature. So you see swimming. I'm very proud. I've won medals. They dance. They have a real passion for nature and animals. So what we can say, using another classification of intelligence, is that they have an extraordinary visual spatial intelligence, they have a musical intelligence, a natural intelligence, and the spiritual intelligence, which is the sense of the evil and good. These are their projects for the future. So they want to get married, to have children. So in 48% of cases, they want to find a job, they want to heal, they want to, let's say, just to live, living day by day, letting destiny and loved ones change my life. And just few of them were, let's say, hoping to heal or thinking that the future will be difficult, only 3%. But it's very interesting to see how the relationship, they live quite in a romantic mood. The relationship is, they are so important, and they are the future hope. So when we use the classification of intelligences of Howard Gardner, this was a book published in 1984, quite far away, but this book is called Frames of Mind. He speaks about not only the famous IQ, but also many other different intelligence, like the linguistic and reflective intelligence, words, logical and mathematical intelligence, but also musical intelligence, visual spatial intelligence, kinesthetic intelligence, body intelligence, interpersonal, relational intelligence, introspective intelligence, about emotions and mood, natural intelligence, the relationship with nature, existential intelligence, reflections of good and evil. We'll come back on this because I think that this will be very important to contain and to fight the stigma. Their food relationship, these are what they say about themselves. So these are children and adults with Prader-Willi. They are the women, they report a more complex relationship on food. So these are the women. You see the red, it's a complicated relationship with food, whereas the men, they are not so much scared about the food, but the women talk about how they eat. So the relationship, that's very, I would say, very gender. And the men focus on the list, on what they eat. So they produce a detailed list of what they eat. It's very interesting, the strategies for avoiding to think of food, go out and walk and stay in contact with nature. So they are really discoverers, and they are, let's say, moving from a restitution mode to a quest mode, like going to and discovering some other solution to stay away from the obsession of food. And classifying the narratives, what we can say, there is no right or wrong, first of all, but these are the good news, that the people with Prader-Willi, according to the John Lohner classifications, is they are very open to the future. They are very progressive. So they are full of coping factors. And I don't have the time to mention how we decided that they were progressive. We were independent readers, there was a methodology, and that's it. So there were also a lot of restitution. As I said, if I follow the rules, I will be rewarded back with my health again. The coping is positive, yes. Sorry for the yes and no, but you understand C and no. And they talk a lot about themselves, their emotions, and they talk also about the stigma here. This is present in this column where you see the 31% of sickness. Let's say I never had friends in my life because everyone thinks I'm sick and contagious. Sometimes I'm sad because I can't have friends, and there are episodes of discrimination at school and teasing by classmates. What happened during COVID? This was again an update of the research. This is the same person. So before COVID-19, I was doing many things and my life was full. The virus stopped everything. I stayed at home for many days without doing anything, and I gained weight. And I was very cheerful because before COVID came along, I went out with my friends, I was counting, I went to school, I went a lot with my parents, and COVID arrived and we were locked at home so as not to make crowds. The school were closed and we studied with distance learning with PC, tablet. I did the test online. Yes, this was quite a coping. So the emotions during the lockdown, we measure the emotion during the lockdown. Well, the first emotion is sadness and then anger. The sadness, it means a loss. There is a loss of something. Anger, serenity, irritation. And I'll go fast. The physical exercise embodied during the lockdown. Here we are still on the point of the people living with Prader-Willi, not on their parents, not on their relatives. You see that the physical exercise, the COVID was a disaster for the physical exercise. I did not practice 38%. I practiced then the usual, less than usual, 46%. I practiced the same, only 15%. So it's nice because there are people who are inventing new solutions, like the landing 21 games and then the garage space about 70 meters back and forth for another 20 times. We took it as a game and competition between mother and daughter. With the food, the relationship was better, the same, but also there was obsession, there was too much food somehow. So difficult thing. Now I will give the word to the caregiver family members. They are 70% mothers and father in 27% of cases. This is now we are before the COVID, okay? And we're starting from the beginning in this journey. So we're starting from the communication of diagnosis of Prader-Willi. So they told us that she was suffering from Prader-Willi, a very rare disease whose characteristics were a compulsive search for food that would lead to obesity. And you see here the stigma, a very severe mental retardation. This is why we want to use multiple intelligence scheme to defeat the stigma, and we are really fighting with this kind of labeling, severe mental retardation. This is an example of bad communication. The phone rings. Is this Mr.? This is confirming the diagnosis. Your daughter has blah, blah, blah. Excuse me, what it is, the disease. So we find there is really some sort of cruelty or an absence of empathic language. Empathic language. This, I think that there should be so much to do on this field. This is the burden of illness shown by narrative, by the caregivers. These are the parents. It breaks my heart to see my daughter when she meets someone with ice cream or a cake. We didn't even go out for a pizza anymore, garden on site. Our life was changed. I need to unplug from time to time. For me, it became an obsession. I'm like a jackhammer. You can't eat there. That's way right. You need a lot of patience, maybe more than jobs. So this is the consequence of having a person with Prader-Willi, and the women are paying, the mothers are paying, I don't know if they are paying or they are, well, the life has changed somehow. So why 67% of fathers manage to keep their professional situation unchanged? I don't know. This is very Italian. So you have always to consider whether this is applicable also to your context. It's women are making the most sacrifices, with only 37% of women managing to keep their professional status. Then COVID came, and there was a total lack of possibility to relate with others. These are the points of, this is a point of view of the parents. If not via Zoom, brought my son to pathologically bind himself to be, considering me the only reference point, with a psychiatric situation precipitated. Despite being at home and in isolation, we try to maintain our habits as much as possible. So this is a coping story, a progressive story. So again, other narratives. I leave all the slides. You can go with this and you can go in detail because I know time is short. So now, access to healthcare facilities. There was a huge problem, not only for Prader-Willi people, but for all other non-COVID conditions. So this is the point of view of the caregivers. The caregivers, they say that only in 16% they have the visits, or but visits were postponed. You see this green column in 52% of cases, no planned visits. So medical disinterest. And this was the point of view of the parents. This is the caregiver, how they felt. Their children felt loss, felt sadness here. They felt apprehension as first emotion, acceptance as second emotion, and sadness is the third, and trust is the fourth. But serenity is quite low. Now, the point of view of healthcare providers, this is before the COVID. First of all, I want to stress the fact that they all stress the importance of the multi-professional and multidisciplinary approach. This is how the KIP is formed, okay? And I just want to stress the fact that they were mentioning a lot in their narratives, the cohesion, a good cohesion with the internal multi-professional and multidisciplinary team, but there was not so much awareness of the social services, of the volunteers, of all the services which were, you know, outside the hospital. So this what we found out, what the Prader-Willi, what the praxis study really showed up, that we have to connect better the intra-hospitals with the social services outside. I felt during the COVID apprehension, vigilance, fear for their health as well. So this is quite consistent with the point of view of the caregivers. COVID came, the body stayed indoors and had serious problem with food. Okay. We started to do the video calls. The parents send their consent to the video, and I carry out the control visit and send the GH, growth hormone treatment plan. And so these are some numbers. Emergency department, we see that send communication, 73% said yes. Telecare, 91% said yes during COVID. Home care, known, and that's it. The interesting part of the story is that there is a misalignment between the perception of the HCP, so the healthcare providers, who said that they have treated and seen their patient through telemedicine, and the parents' point of view, who said that they were not treated, so that the telemedicine is not a tool to be treated. So there was a misalignment in this case. Now, final consideration. So I'm going really to the end. So there was an extra participation, great enthusiasm. This was great. The private COVID era was easier to manage for sure, because there were so many distracting activities for children, young people, schoolwork, day center, sports, walks, friends, theater. We should rerun now this study now in 2021 to see during. Okay, I'm just going to the end. I hope that I made it. Let's go to 62% of family members had to leave to change jobs, most of them women. There is a cruelty of branding and predictive words when communicating the first diagnosis. The impact of COVID-19 in 2020 was really creating discontinuity and creating sadness and loss, and caregivers were called to invent a creative solution to create distraction in limited perimeters. The caregivers have postponed the care while the professionals have been present in the places. This is quite a mismatch. So this we have to find, but this is the beauty of narrative studies, that you collect different point of view. I've not been showing it, but the COVID was metaphorically depicted as a monster, like, and not as a fight, not as an enemy. So it's like an aberration of nature. Final consideration, we have to work on other intelligence, from visual, spatial to musical, natural, and existential, with creative solutions. The virtual care can be the system for maintaining care relationship. Now it has improved a lot. Well, I think that health professionals in collaboration with social services can create an ecosystem of networks of study and collaboration.